So when you're diagnosed with cancer, you have to make a lot of decisions all the time, and they're not easy decisions by any means. Never did I think that I would have to have a will or a power of attorney when I was 23 years old. Well, I still don't have one, which I should probably do. That's a good note to make. But you have to make a lot of decisions. With my first chemotherapy treatment, I had to decide if I was going to freeze my eggs and ovaries to see if I could reproduce in the future, because chemotherapy drugs actually kill your reproductive organs. So I had to make the choice to prolong my treatment and do these treatments in case I want to have kids in the future, or just start my treatment right away. I've never personally really wanted to have children because I think there's a lot of kids out there that need parents that don't have parents, so I was always going to adopt. So I opted out of not doing the freezing of my ovaries and eggs, because if it was meant to be, it's going to happen. It could still happen, you know, there's been crazier things, but as of right now, I can't have children because of the chemo drugs have killed my ovaries and my reproductive system, so I haven't had a menstrual cycle in actually like 2 years, which is really freaking cool. I also had to decide on if I was going to continue with my treatment. You don't have to do any of these treatments. They're all on your choice. I moved to Madison, Wisconsin when I was first diagnosed with cancer, and I was seeing a doctor there, and he kept flip-flopping back and forth between, oh, you have to do it, or you don't have to do it because there's not really that big of a life expectancy span. He told me I had a 2% chance of living past 5 years. We're coming up on 5 years now, and that's just 5 years after your stage 1. So I was stage 4, so I'm way past the statistical mark, and I'll take it. But I made the decision to leave Madison, Wisconsin, because I didn't like the doctor, and he wasn't comforting me. So then I moved back to Lansing, and I made the choice to get my treatment done here. However, there aren't many doctors that specialize in sarcoma, and it just so happens that there's a really good specialist in Ann Arbor, and he is my doctor, and he is amazing. He has the best rapport with me ever. We first discuss how I'm doing and then what my issues are. He always knows like when my landmark things are coming up. Before I could even tell them I graduated, him and his nurse had already came in the room and were congratulating me on graduating from college. So he really cares about his patients, and I was missing that with my first doctor. So I've had to make a lot of hard decisions, and I'm going to continue to make a lot of hard decisions to hopefully best benefit my life in the way I want to live it. Another decision I've made is that I'm not going to have any more further surgeries that would possibly help me live longer potentially. I made the choice of not having my pelvis tumor removed because that wouldn't be a life that I would want to live. I enjoy a lot of things every day, and I'm active, and I travel a lot, so those are things that I like to hold on to. I also made the choice to prolong some of my treatments so I could do it in my time so it wouldn't throw off what my life is and be the #1 main factor of my life, because it's a large part of my life, but it's not me. I'm not my cancer, and I'll never be my cancer.